Hello, and welcome to my summer research project. My project focused on evaluating the confounding factors influencing the 6-minute walk test, and I utilized the Ambulosono wearable sensor. So first, a little bit of background on the 6-minute walk test. The 6-minute walk test is widely recognized as a pivotal clinical assessment used to evaluate physical endurance and mobility. The test evaluates parameters such as walking speed, perceived exertion, and walking distance in 6 minutes. Essentially, the test is conducted by a participant walking between 2 points on a designated pathway for 6 minutes. Now, despite its widespread use, the 6-minute walk test is still fraught with limitations. These can include things like accessibility, costs, and inconsistencies in test outcomes. Did you know that even the mood of a test administrator can affect 6-minute walking test outcomes for a patient? Now, in a clinical setting, confounding factors can include things like patient changing the behavior due to being observed and a lack of standardized protocols between testing centers. In an at-home setting, things like uneven walking surfaces, environmental distractions, and motivation levels may affect test outcomes for individuals. Now, wearable sensors have emerged as an alternative to allow for more accessible and cost-effective solutions. However, there's a lack of research evaluating the effects of external confounding factors and the differences in test settings and how these may affect outcomes using wearable technology. Now, for our research objectives, this study addresses this gap in the literature. We seek to understand differences between clinical and at-home setting use of wearable technology and further explore the effects that auditory conditions may have on the 6-minute walk test. The Ambulosono sensor is utilized as a novel approach, and it challenges the status quo of conducting mobility assessments in clinical hospital-like settings. Furthermore, we pave the way for more reliable and effective test methods. So, the experimental design. Our study split participants into two groups, the naturalistic setting and structured setting. In the naturalistic setting, participants took the device home and conducted the tests in an unsupervised setting. In the structured setting, participants conducted the tests in a clinical supervised setting using the sensor. So each group partook in 3 walking procedures. During the silent walking, participants completed a 6-minute walking test using the sensor without any auditory stimuli. In the verbal condition, the sensor played verbal instructions, words of encouragement, and in the music condition, the sensor played music as the participants walked. Distance walked and walking time were evaluated. So all instructions were delivered via the Ambulosono wearable device to ensure uniformity in test conditions. The Ambulosono device is equipped with a sensor that has accelerometers and gyroscopes, and an Ambulosono phone that allows for protocol selection and data upload. The high-performance knee band is used to hold the sensor in place. So this is an example of a participant completing a walking test using the sensor with the sensor attached to their knee. So methods of analysis. Our study utilized these during test outcomes and seek to find the differences between these test outcomes and conditions. Analysis involves using AI tools for preliminary analysis and data cleaning, and then statistical methods such as t-tests and effect size calculations. Now for the results and the impact. So depicted here is a grouped bar chart of mean walking distances between the structured and naturalistic settings for the 3 conditions. The 3 conditions on the x-axis. Again, the structured setting is the clinical-like setting, and the naturalistic setting was where the participants took the device home to complete the 6-minute walk tests. So in the verbal and the music conditions, there was not a significant difference between the 2 settings. However, in the silent condition, participants in the structured setting walked significantly more using the sensor than they did in the naturalistic setting. All right, now from the discussion and impact. These findings suggest that auditory cues may be serving as a buffer against confounding factors, where in the verbal and music conditions, there was not a significant difference between settings. However, in the silent condition, there was. This offers critical insights for healthcare providers and lets them know that careful consideration needs to be taken into account when conducting clinical assessments, especially in different settings. This establishes a baseline for walking behaviors in healthy participants and lays the groundwork for future explorations. Now for the conclusion and acknowledgements. Our study provides valuable insights into the role of auditory stimuli and the environmental settings for healthy individuals. This lays the groundwork for future explorations into things like investigations for patients with Parkinson's disease and other mobility impairments, and because this could significantly enhance our diagnostic and preventive strategies. This study pushes for the integration of wearable technology in routine clinical assessments and encourages a patient-centered, precision health approach for personalized intervention. These are the literature references. I would like to acknowledge Dr. Bin Hu and Dr. Taylor Chomiak, everyone on the research team who made this project possible. Thank you.